Hello everyone, my name is Dr. Sudheer Koganti, consultant interventional cardiologist and heart failure specialist at Citizen Specialty Hospital. I wanted to meet you all through this virtual forum and raise some awareness of cardiovascular disease on the eve of this World Heart Day. World Heart Day is celebrated on the 29th of September every year, and this was originally conceived by World Heart Federation way back in 1997. The reason for this is to raise awareness about cardiovascular disease among the general public. Do you all know, according to World Health Organization statistics, 17.9 million people die of cardiovascular disease every year. No other disease kills as many people as cardiovascular disease. This year is particularly noteworthy because of the prevailing COVID-19 pandemic for various reasons, which I will go through in the next few minutes. First, let's discuss about cardiovascular disease and who gets cardiovascular disease and who are at risk of getting cardiovascular disease. Cardiovascular disease is a broad term used to describe diseases of the heart and also of the brain. The commonest of these are heart attacks and brain strokes. People who have certain risk factors are at particularly high risk of getting these problems. The risk factors, or the traditional risk factors which we counsel people about, are diabetes, blood pressure, smoking, obesity, high cholesterol levels, and family history. Of all these, family history is the one which you cannot change because it is passed on through genes from generation to generation. Therefore, somebody who's got a significant family history of heart disease or cardiovascular disease should be particularly careful about their lifestyle and also controlling other risk factors of the heart diseases. Now let's look at each risk factor individually. Smoking is the single most important risk factor which contributes to cardiovascular disease significantly across the world. After putting a ban on public place smoking in the Western world and also now in India, the incidence of cardiovascular disease started to come down. Therefore, I advise everybody to take an oath on this World Heart Day to quit smoking. Those who have quit smoking, you've done an excellent job. Please stay away from starting it again. Rest of all the risk factors that causes cardiovascular disease have got a similar pattern. Diabetes, high blood pressure, obesity, high cholesterol levels, all are related to a poor lifestyle. All of these risk factors can be controlled by following a good diet, adequate exercise, and if at all diagnosed with any of these risk factors, then aggressive treatment given by the respective specialist and also regular follow-up will help in preventing getting cardiovascular disease. Now, we come across patients who start treatment and then stop treatment without the doctor's advice, and that is not a good idea at all. And by adhering strictly to these to this regime of active lifestyle or a good lifestyle, we can prevent getting cardiovascular disease. Because once you're diagnosed with a cardiovascular disease, or once an individual is diagnosed with a cardiovascular disease, that is going to be there for the rest of his life, and there's no rolling back. Let's briefly touch on the issue of COVID-19 and cardiovascular disease. As you all know, COVID-19 is currently classified as a pandemic and is affecting millions and millions of people across the world. There are a lot of people who are recovering with mild symptoms. However, people with cardiovascular disease are suffering a lot with major symptoms and are also getting really sick and getting admitted to hospitals. Therefore, controlling cardiovascular risk factors during this time is particularly important. One other aspect which I would like to touch upon is people who are diagnosed with cardiovascular disease or who had cardiovascular disease in the past and had some treatment are not coming to hospitals because of the worry of acquiring coronavirus. Now, all the precautions are being taken in the hospitals by using masks, sanitizers, and safe distancing. Therefore, if you are a cardiovascular disease patient, please do not delay your appointment and attend them regularly. If you would not like to attend to hospital physically, I would advise you to take a video consultation so that your doctor can assess if your care can be continued at home or if you need to come to hospital for further consultation. One other important thing is emergencies. Again, there are lots of instances where people are ignoring their symptoms such as bad chest pain or speech problems or weakness in the arms and hands, thinking that it will go away and not coming to hospital on time, again due to fear of acquiring coronavirus. However, this is leading to them presenting at a later stage in a much sick way and unwell. The treatment becomes much difficult to deliver when people present at a later stage in these sort of cardiovascular emergencies. Therefore, again, I urge you not to ignore any symptoms that are suspicious of cardiovascular disease, like chest pain, sudden onset breathlessness, swelling of the feet, speech problem, weakness in the hand or leg, or drooping of the face or the eye, but to seek medical attention immediately. On that note, I'll take leave. Please do stay safe, and we at Citizens Hospital are available 24 hours around the corner and are ready to deal with any emergency in case you need us.